It's a relationship between a surgeon and their patient that is sanctimonious. We want to get to know each other. We want to have known that you tried everything in our power to get you better with the least amount of risk. We still have to take one step at a time when it comes to people's lives. I always knew I wanted to do orthopedics, but it wasn't until my clinical research years at HSS in New York that I really fell in love with the intricacies of spine surgery. It's a very exciting time to be in spine surgery. There's a lot of minimally invasive approaches that we are using and technology-enabled approaches as well to kind of do the same thing we used to do, but through smaller and smaller incisions and with more precision and accuracy. Yeah, my life is full. I have a wife and 2 young boys. I spend a lot of my time with them, going on camping trips and adventures to try to make their life just as nice as it was when I grew up. With Synergy's integrated model, we have all the parts in place for a patient who's even thinking about spine surgery to try and avoid it. And there's like-minded physicians and providers of all different levels and skills and backgrounds that come together to look at a patient as a whole and to get them to their next step, whether it's, again, through conservative measures or through surgery. Getting people back on their feet is what we are here to do.